Well, hello there, and welcome to a video that I am actually very happy to make, and that is an announcement that I am actually back on the road to recovery after our last episode where I explained that I'd be going in for surgery and be gone for some time, which at the time I thought was like a week, 2 weeks max. Turned out to be a little longer than I thought. I underestimated the amount of recovery that I would need for this. But I want to stop and thank you all so much for the support on that last episode. That meant so much to me. Absolutely warmed my scarred heart. All the messages when my mom was updating you guys on Twitter and Instagram, she showed me those while I was in the hospital in the ICU on the ventilator. It just put so much positivity into me at the time of like most needing it. So I very much appreciate that. So where we left off was going into surgery. And just a quick recap, I have a neuromuscular disease. I have a J-tube. That's where I get my nutrition, my medicines, and things like that. It kind of bypasses the stomach, goes directly into the intestine. And that tube became infected with a bacteria called Pseudomonas. And Pseudomonas is notorious for sticking around when you're an immunocompromised, a medical device that it can kind of adhere to and create like a film across. And that, of course, was the plastic of the tube. And it was very difficult to get rid of to the point where we couldn't. They tried everything, all sorts of antibiotics, and there was so many errors. It was just an absolute nightmare that led me to the point of needing the surgery. And well, yeah, it turned out to be a little more than I thought. So they opened up the site where the tube originally was, so they could kind of investigate, try to figure out what was going on there, and of course relocate the tube to a new location. And while I'm at it, why don't we just do an endoscopy and a colonoscopy? Well, I am out of it, so you would avoid extra anesthesia in the future or in the past where these things got kind of delayed. That is what they did, and in the process, they were able to successfully put in a new tube. So open a new spot, create a new track into the intestine, and then over on the other side where the old site where the infection was, they were able to open that up further and then look inside and find that they had some stuff going on in there. There was a elongated like golf ball is what they called it, full of like abscess and scar tissue, all this terrible stuff they were able to take out of there and then set that area off to having a better opportunity to get rid of the infection, to heal. So it's open and it's kind of healing from the bottom. That is thankfully going to be on its path to recovery. The J-tube's new site's a little sore, but it's going on its way to being in a good position. The endoscopy and the colonoscopy, they were able to find some things there that we're now working towards fixing and finding remedies for. The colonoscopy prep started on Tuesday. The procedure was on Friday because you can't really bolus feed a J-tube. It had to go very slow at like 50 milliliters or less. So you're 2 liters plus going through there. It was a lot of sleepless nights on the porcelain throne. I'll tell you that right now. Another sleepless night, the night of the surgery. Had to wake up at 3:45 to get to the hospital. And we get there, right? We check with the National Guard at the door. It's a sign of our times, I suppose. And, they send us down to the PACU. So we get settled there. They've got this blanket. And I got to tell you, it's the greatest blanket of all time. It has a little valve you can send hot air into. It was amazing. The bear hug, it was called. So I'm enjoying the blanket. A little nervous. I know too much, and I've seen too much in my time in the hospital. So yeah, I was a little nervous, to be honest. Unlike the guy next to me, he was like, I don't know why I'm here, actually. The doctors just said to come on in, so I'm here. And I'm like, I envy the naiveness. But so eventually, I'm pretty calm at this point. I get a little nervous, but I'm good. I just want to get past this, right? There's a big hump of recovery ahead of me, but I'm gonna get through this. Just take some time, and we go through it. We talk to my doctor. She's wonderful. She heads off to kind of go get her stuff going, and then she comes back a little bit while later, and we're kind of feeling like something isn't right. The curtain opens. She's like, "You seen anesthesia?" And I'm like, "No." Huh. Closes that, and I'm like, My mom's like, And eventually anesthesia comes, and he comes in, he's like, somebody else was going to do this, now I'm going to do this. And we go through normal anesthesia questions, and then all the stuff pertaining to me, like I have to go to the ICU to slowly be weaned off the ventilator because breathing is such a nightmare coming out of anesthesia with my neuromuscular disease, and then all sorts of other issues that I have coming out of anesthesia. So going to the ICU, being in a safe place to be watched over very carefully, and then having a secure airway, it's very important. So, and then this is all taken a lot of planning. ICU beds are very scarce. making sure that these teams that are going to do the procedure components, the endoscopy, colonoscopy are there, the surgeon's there to do their part, and then the ICU intensive team is ready for when I get transferred. There's a lot of moving parts that had to be organized, and anesthesia was a little bit concerned. Anesthesia kind of has the last say, if I'm not mistaken, for the safety of the patient. So they can call off a surgery if they don't think something's right or safe. And then my surgeon's like, also like, this needs to happen for him. A lot of work went into this. This needs to happen. So they're just trying to find what's best and what's safe for me to do. And they're concerned about my heart having breakthrough events while under anesthesia. So I have heart medicine that controls certain things that go out of control during surgery. So they want to talk to my cardiologist. It's like 6 a.m. and I don't think the gentleman's awake. And my doctor slides back in. She's like, okay, I ordered a echo. I hope I didn't step on anybody's toes, but I think this will give us the best picture. And they're like, oh, okay. So they get the echo. What they're looking for is like, I had some tests where my CO2 was a little high. And then the other stuff I said, but the echo came back okay. And we're like 3 hours into this. This is a long process of like back and forth. My mom and I were like, I'm going home at some point. This isn't going to work out. But the echo came back okay. And I said, we're 3 hours in. They're like, you're clear to roll. So we roll on back into surgery. They keep me awake for as long as possible. So they're doing a lot of stuff that they otherwise might have, already had somebody go out for, because they want to limit the amount of anesthesia that I'm on. And, if you get some stuff done before being knocked out, you could cut out a half an hour to an hour of anesthesia. So they do that. They're putting in an art line. The student got a lot of practice. He poked many times, to the point where the attending told him, if you continue the way you're doing this, you will give him a bloodstream infection. I'm like, I don't want that, by the way. Please, none of this. And then they were going to give me a medicine that I was allergic to. And I'm like, oh, no, I'm dodging. I'm weaving it. I'm like, no, I'm allergic. This is the second time this has happened in a year where a medicine I was allergic to was coming at me. And I'm like, no. But anesthesiologist was wonderful. He limited to like 2 drugs, got rid of all the other ones, like through rock rhodium. Was like, no neuro blockers, nothing. We're gonna make this so you have the best chance to come out of this as fast as possible, which he was wonderful. Very appreciative of him and my surgeon. Go off to sleep and wake up. Got all my normal nonsense that happens when I come out of anesthesia. Still on the ventilator. My arms are tied to the bed, which I was very upset about. And also, I couldn't open my eyes. Like, I'm awake. I'm just looking like straight ahead. Eyes couldn't open. It was like out of a horror movie. Just looking at the back of my eyelids. It was very scary. And then there was a wild, crazy night. And then in the morning, things were a little calmer. The day nurse came in and was like, all right, talk to your parents. They said you're not going to pull this tube out. I need you to pinky promise me that you're not going to do this. And I'm like, and I put my finger up there and she's like, okay, that's not a pinky. We're just going to do a finger promise. Not as strong, but still strong. So we do that. I promise I'm not going to, not going to pull it out. That day went okay. I was starting to recover, but I wasn't breathing enough to feel safe taking off the ventilator. I wasn't giving enough of an effort. The machine was doing most of the work. So they decided to push it to the next day to try to wean and then extubate from the ventilator. Unfortunately, I got smashed with a fever, very, very sore throat, congestion, headache, all this stuff. It was making me very, very sick. So they're swabbing the nose, looking for what. Luckily, it wasn't that, but I got very, very sick. My electrolytes finally just collapsed. All that prep, the lack of any nutrition for multiple days, led to the point where my blood sugar was like 38 or something. I think that's low. And they're pumping in sugar and it made me pass out, like the sudden shock of it. They're doing that all night. They're putting in electrolytes because 3 of them went critical. So like potassium, magnesium, phosphorus, they were all incredibly low for like days. It was, I'm trying to remember, it's fuzzy, but like 3-something days on a ventilator, like in and out of consciousness. Sometimes I'm like fully awake, and then sometimes they'll turn on medicine a little bit and I'll kind of go to sleep. But for the most part, I was pretty much awake the entire time, just feeling horrible. But eventually getting a little bit better, a little bit stronger, to the point where they're like, we need to get this tube out. So they start doing trials of like making myself have to, use more and more of my own body to start breathing again. Breathing under in a little tiny straw in your mouth is incredibly difficult. Eventually they were able to extubate, pull the tube out, and it's like, ugh, and you're like, eventually you start breathing, and a few hours later, you kind of maybe get a little bit of a voice back. And yeah, so that was quite a few days of just wild stuff. I gotta admit, it was a little scary at times, but seeing your guys' comments, my mom would show me my phone. It was absolutely wonderful to see all your comments. So thank you so much for that. The back half of the hospital stay was a little confusing. In a big institution, you'll encounter at times a lot of teams. So this team might be doing very specific thing with you. Then there's a team that's kind of the overarching group. Then that team relies on this team. And then there's another team that might counter. There's some ego sometimes get involved. So there's always that kind of confusion that happens, especially in a big hospital. It's kind of the Achilles heel of them. They have a lot of benefits, but that's always one of them, is the communication amongst the teams is often poor. And they decide to put in a pick line, and then they're like, never mind. And they want to take it out a day later, send you home with antibiotics. And then never mind, we're not going to send you home with antibiotics. We're going to do these tests. Never mind, we're not going to do that. Like, it just got a lot on the last day. So my parents and I had to, it was stressful, but thankfully everything worked out in the end. Even with all that, I, super tremendous respect for all the doctors and nurses that I saw. And especially during this time, everything is just absolute chaos. And it's just, so I was lucky that I had a really great group of people taking care of me. And it all went as well as possible. My parents went through a lot, so I really appreciate that. And maybe you guys could write something nice for them in the comments. Just really appreciate you guys' support during this. I hope I'm on the right road to finally be over this infection, and we can get back to making videos, streaming, having the fun that we've planned an entire year for, that we barely got any of the stuff done that we wanted to. So we're on the right track. 100 hours coming. We've got Hermitcraft coming eventually. And I just got to say, like, sometimes you really got to evaluate and appreciate what you still have. So if you even if you're chronically ill or disabled and stuff, and a lot of things aren't working or don't work, but sometimes there's a couple things that still are working, and you got to appreciate those things when you can. And you think, like, these things are bad, this is bad, this doesn't work, this is just painful, but you know what, this and this aren't. And it just gives you like a little like appreciation, like these things are still good. Because when those things go away, when those things fail and you start getting worse and worse, it's good to remember times that things were good, so you have that like appreciation, and it helps you try to get back to that. And just generally just appreciating the time that you have, and the time that you have that's good, and trying to be as healthy as possible, because when your health goes out, it's not great. So that's where I'm at the moment. I am on the road to recovery. Got some fun stuff coming very soon, and I'm super thankful to have you guys as a community. So thank you very much. I hope you guys are excited for her as much as I am for all the fun stuff coming. And with that, thank you so much, and we will see you later.